Hi, happy Saturday. I'm Alicia with Mama Bird Lactation Services. I wanted to come on here and kind of share what's in my lactation bag. So these are the things I'll bring to my appointments when I do in-home visits. Sometimes it changes. I might need to get more supplies or different supplies, just kind of depending on what I'm going into. So most lactation consultants will have these items, or they might have more or less, just kind of depends on what is going on. So I wanted to show you guys what is in my bag. So first thing, I have my scale. It's hospital grade, so we can get a very accurate reading on those weighted feeds. Most mamas want to know, how much did my baby get? So it's important to know also that just with that weighted feed does not mean that's how much they're getting every time. So I always try to remind mamas, this is just a snapshot in time. It's not what they're getting every single time. It might be more, it might be less, depends on the day, the time, when they last ate. It just kind of depends. So it's just a little bit of information in the big picture. So we have that. I bring babies, my little babies, to kind of use as demonstration. I'll either show different positions, holds, different ways to feed with a bottle, introducing a bottle. I bring a couple different kinds of bottles that we can try if you need. I always, with my clients, I will give them one of these silicone breast pumps if they do not have one, and we kind of go over the importance of these and when not to use them, and kind of just getting them comfortable with it, because I think it can be a really great tool to use. So I bring nipple shields if they need, different gel pads if there's any issues. I have these little syringes. I give each client a couple to drop some milk and freeze away for those times when you might need a little bit of breast milk for eczema, cuts, pink eye, clogged ducts in their eyes, for just any little thing. You can use it on your older kids, babies. It's good to have. You can also use syringe feed, so we can talk about that if that's something that needs to be done. I have some more comfort gel pads, and then I have tubing for if we need to do any SNS, the supplemental nursing system. We can set that up for moms if they want. Another thing I bring, of course, all my paperwork. I have all sorts of handouts that I give my moms. I'm trying to put them all on my care plans, and so it can all just be digital and I don't have to give a ton of paper. So usually I'll have my little Chromebook. I will chart in my computer. I can make my care plan from here, send it to my moms. Super easy. Let's see, I always bring these my breast friends right here. So I like to show and demonstrate on here how to maybe hand express, breast massage, lots of different things you can do with these little guys. So these are a great tool to help, so I'm not always touching myself when I show my mamas how to do that. So I have these little cute coloring books right here for older siblings. They always like it. Just kind of goes over about their mom breastfeeding, and I think it's really sweet and kind of gets them involved and kind of explains to them what is going on if maybe they don't remember their journey. I have a baby wrap that I can show moms how to use. If they have one, I'll usually say, let's get it out, let's try it. I will make you feel comfortable wearing it. I really encourage baby wearing, skin to skin, doing that as much as you can throughout the day, especially with those new tiny babies. I have some hunger cues. So I have little tear-offs that I give new moms. Goes over poops, and then hunger cues. Let's see what else we have. Gloves, of course. If we need to do an oral assessment, I usually will do those on all babies. Just check and see what's going on in their mouth. If mom is okay with that, let's see. And I'm sure there's a lot more that I have, but that is the gist of what I usually bring. Sometimes it's more, sometimes less, of course. So yeah, that is what your lactation consultant will probably bring on their visit. So if you have any questions, let me know. Any suggestions or just comments, let me know. So yeah, thank you. Have a great Saturday.